Our vision and our mission statement was to be the first choice for emergency services providers. I was working for Pfizer and I was living in the UK and I loved it. And then I moved to a startup because I kind of thought I was getting everything from the multinational but nothing from a startup. And I loved working in the startup. It really opened my eyes and probably was the best experience I needed. And Seamus was in healthcare, he was in international sales, and we were in the UK talking about coming back to Ireland. I suppose although I was enjoying what I was doing with the startup and he was enjoying what he was doing, when we talked about coming back, we couldn't envisage really working for anybody else. We were looking at other options, but every time it came back to the discussion, we'd go, we could do this, we could do this. For us to be in the Midlands, it was an ideal spot to be. Shortly after we were here, the M6 opened, so we could get to Dublin in under an hour. And that really transformed the way we could do our business. It allowed us, for example, to win the first tender that we ever went for with Dublin Fire Brigade. And their remit was that you had to make it to Dublin in under an hour. So for us to be the first company outside Dublin to have ever won that contract was really significant for us. We started out as a distributor, that's what we were in the very early days. So as a young company looking to distribute product, we still needed to be careful that we were in it for the long term. So we had to ensure that the products we were taking were going to be from a good stable. The key behind it was that we were persistent, we had our vision, and nothing was going to make us kind of step below the standard that we were setting for ourselves. I think we'd also, having come through multinationals, we had learned a lot from being with them about processes, people, maintaining standards. So we weren't going to compromise on that. One of our big goals at the time was, how do we start manufacturing our own product? We needed to create our own line of product in order to add value. We developed a range of product that we call Duramedic, and it's a range of medical disposable products, and that really allowed us to compete properly on tenders. I suppose 2010, 11, we, again, from talking to our customers, started to identify the areas that they were having challenges with when it came to procuring product, and hence born Metalogistics.
Metalogistics was really defined by the customer's desire to manage, from their perspective, all of their products on one system, and then bring in all the different levels of control that they needed. It meant that for the first time ever, they were able to have one standard catalogue. Then it evolved that they had standardization of the products. So it means that there's uniformity across all the vehicles and stations, that everybody has the same item, basically in the same location. So they can change vehicles at will, knowing that everything is standardized. Then from the customer's perspective, it's about the data. And for the first time ever, they knew exactly what they were getting, how much was being spent, and they started then looking at data and analysing it in a way we never actually envisaged them doing it.
So the HSE were being targeted to reduce their budgets, stop spending money. But we started to talk to them and say, well, where are you spending your money? Because it's not on medical consumables.
When we did our first data analytics of it, we showed where there was 37% saving on a spend of only 2 million within one organisation. That was a massive amount of money.
So it's a just-in-time service. They only order what they want. They only order what their management team have already approved, so products always will comply with what they've been trained upon. They work within budgets, so they know exactly what they have to spend and they won't spend any more of it because the software doesn't let them. And they get their scheduled deliveries. So if they order on a Monday, they do it because they know they have to have that delivery on a Wednesday. So it completely transformed the ambulance service.
When we go into the market, people sometimes don't even call it critical healthcare anymore, they call med logistics. They've bought into the name so well as a process. When we were first doing this, we were probably struggling to pick up about 2 million a year. Our plan is to drive the business to a 50 million business, but we now see where we're going to go with that and how we're going to do it. And again, if you go into any other export market, you see the potential, and the potential is now where we're looking at customers between 250,000 and 2 million.
It is all about having that vision and making sure that you keep looking at your business. What are you doing? How can you make it better? Because if you stand still, you're only going to go backwards.